Hey, my financially intentional people. We have an amazing episode today with our guest, Oxana Parfanova. I knew
You
I was
got
going
it.
to mess that up. And we're going to talk about healthcare options outside of traditional employment. So, people who are self employed, I have a lot of nurses who follow me, travel nurses, people in early retirement. One of the biggest questions is, how am I going to be able to afford health insurance? And that's because health insurance and paying for medical care in the United States is a cluster F, and it's extremely expensive. So you don't ever want to be caught slipping in these streets without insurance, because even the healthiest person can have some catastrophic medical expenses if they don't have health insurance. So, welcome, Oksana. I'm so happy to have you here. Love that you get to talk to my people. So, let's get started on your background. Like, how did you get introduced to this healthcare insurance space?
First of all, thank you for having me. Happy to be here and spill the knowledge. I'm an immigrant, so I moved to the United States from Russia in 2008. I started working in hospitality industry, so I come from long working in hotels, bars, server, bartender, name it. And with COVID, all the bars, all the restaurants, everything closed. So did my hotel, and I was forced to look for something that is recession proof, something that I don't have to rely on a place to be open or pandemic close it down. So I started venturing out and I ended up in health insurance, which I'm really grateful and I'm happy that I did, because not only that I am able to help people make money and actually help people making the right choice about health insurance, picking the right plan, because it is very complicated unless you actually work in the industry. It's just not that easy. But in reality, I'll simplify it for you. It's not that hard.
I work in the healthcare industry and and I have a master's degree in healthcare administration, but healthcare and health insurance is so dynamic. It's always changing, and it is a struggle to understand. And so I find myself often having to call my health insurance company to ask what's covered, what's a copayment versus what is my out of pocket. Like, all of those kind of crazy things is still
Yeah.
hard to navigate. And I'm blessed to have really good PO insurance, but still it can be rather expensive. I'll give you an example. So this time I'm pregnant, and if I go to the hospital and the medical group associated with the hospital, basically everything is covered through my health insurance, but there are different medical groups associated with the hospital. So I chose to go with a different medical group. And so I have co-payments associated with that. Even though when my whole hospital stay will be covered, there's co-payments associated. And so that's not always outlined in your coverage. So you need to understand that. And those co-payments aren't small. They've added up to five figures right now. So
Yeah.
you need to understand what's covered and what's not, and then you need to have a plan in place to cover that. And luckily, I have a FSA. So that's just going to show that the costs are not just straightforward. And so it's really something that we all need to understand. But a lot of people are super curious if they don't have traditional employment or their healthcare at their job is super expensive, what their options are. So I'm really happy that you're in this industry and you can break it down in a simple way so that
Perfect.
we can understand it. And so,
Perfect.
yeah, let's talk about insurance and what kind of insurance you help people attain.
So I help all self-employed to get insurance if they don't get offered insurance through work, if they don't qualify because they're part-time, or simply if they have their own business. So I help them explore the options. Usually all of your options will depend on your state or zip code sometimes. So don't blame the agent if we can't find you a plan that works that you want. Obviously, the best insurances you can possibly have is through your employer, simply because they have to contribute towards your premiums a lot. It's usually 50, 60, 70, sometimes even 90%. That's what makes it super inexpensive. And those plans are some of the best plans on the market, where they actually, especially the big corporations, they allow you to pick from 3 or 4 different options, and then you can pick and choose your deductibles. Now, it doesn't work the same with the smaller companies. They usually just have one plan for all. If you're employed and they paying for your coverage, it's amazing. Now, for what happens when you lose that coverage, everybody kind of panics here because, and they discover really quick that insurance is very expensive in the United States unless it's sponsored by the employer. So there's only two ways to get coverage outside of your employer. First will be through your marketplace. So each state will have their own exchange programs, Obamacare websites, marketplace. Each state calls it a little bit different, but everything is done through one website. It's called healthcare.gov. Not .com, not any other versions of it. It has to be .gov, and that's where you can go. Simply put your zip code. They do not ask your phone numbers or any information. They'll simply just route you to your state marketplace, and then you can check for options. So marketplace is going to be based on your family size and your family income. It's very important to stay true to the income and not try to manage it and lower it down so you can get a better rate. Simply because when you file your taxes at the end of the year, they reevaluate the tax credits they gave you, and you can find yourself in a really bad situation when you owe them thousands of dollars. It happened to so many people I know. So the first one will be marketplace. Sometimes it's really affordable because your income is low or your family's big. And after COVID, they started giving more tax credits. So they expanded the family size and the income brackets. So that's became more affordable because of the pandemic. Now, there are also private options that are available to you. They're not a part of the marketplace. Private options, the biggest difference, they have a lot more rules and exclusions and what they cover, what they don't cover. So it is important to understand what you're signing up for and whether you need those benefits or not. Private options usually, for example, don't cover maternity. They don't cover alcohol drug rehabilitations. They don't cover mental health. So if those things are important to you, at least one of those things, you have to go with the marketplace. But if you're young and healthy or just don't use your insurance that much and you want to lower the cost and the marketplace is too expensive for you, then you can take a look at the private route and see if that works for you. But like you said, it's important to understand the benefits, and it's important to read into it and see what's covered, what's not covered. Because even, like you said, your amazing employer PPO plan doesn't cover certain things. And what I think the most important thing is always to make sure that you go in network, because a lot of plans, especially marketplace, they have really small networks. So it's really hard to find a good PPO plan through the marketplace. Not a lot of states have that. California does, by the way, but a lot of states like Florida, Texas, they only offer HMO plans, and it's a disaster here. But going in network, and especially what I've been hearing a lot lately, probably with the pandemic, that if you go to an emergency room, for example, the hospital will be in network with your insurance, but the physician they may assign you at the ER may not be.
Yep.
And it happened to a couple of my clients, and they've all had different insurances, and they were like, "Why, Oxana? We call the hospital, we'll try to figure it out," and they simply don't care. They overwork, they underpay, they assign you the first physician that they see. And just a tip, if you're conscious or if you're taking somebody else to the emergency room, just make sure that they assign you the doctor that accepts your insurance as well as the hospital.
I'm gonna tell you right now, that's not gonna happen. They're gonna, especially in an emergency room. They can't prioritize that, and there's other laws that's gonna say that you have to get.
Really?
So if you're in that position where you can ask for a certain doctor to be assigned to you, you probably don't need to be in an emergency room. That's number one. Number two is that because of our EMTALA laws, it's not very often that you could just go in the emergency room and demand a certain doctor, because you have to be seen within a certain amount of time and all of those kind of
Right.
things. And in order to provide quality care, you need to be able to be seen by the first available doctor or whoever is there. So that's,
Let's just forget about it, right?
no, you can try, but the chances
Yeah.
are it's not going to happen. And that's just like me knowing how the system works. So yeah, in
And
maternity
that's
and
good, but
labor and delivery, we have our own emergency department. And
mhm,
so we'll assign you to whoever your provider in your network is. That's just because of our specialty, so we're able to do that. But if you come in and if you don't go to the right hospital, like if you don't go to the hospital you're assigned to in your
mhm.
insurance, then all bets are off. That's just
Okay, yes.
something to note. Yeah.
But even if it's not emergency room, I've had the situations where a client of mine went to just a primary care doctor and they sent the labs to a lab that doesn't accept their insurance. So that happens all the time too.
Yep.
And that is something you can definitely control. And you have to make sure that everything is billed properly. You have to make sure that they assign you. They're actually, the doctor's office ended up paying for that bill. They
Mhm.
picking it up because they were the one who
Sent it to the wrong place.
sent it to the wrong place.
Yeah, but
Yes.
the thing is that what if they didn't catch that, they wouldn't pay for that. So most people don't pay attention to their medical bills. By the way, there a 70% chance that there are errors on your medical bills. So you should always be looking at your medical bills and not just the overall like total. You need to look at the itemized things on your bill because chances are it's billed wrong. That's one aside. To second aside, to mention like the subspecialties and the doctors that are covered, for example. So I always have to give labor and delivery examples because that's my world. But
Mhm.
when you go into labor, you have your doctor, your OBGYN that's going to see you. But if you want an epidural, there's an anesthesiologist. That is another doctor who's not going to be associated with your group. They have their own billing process. So that's another thing that you have to check for. So these are just all good to knows asides, like things about our crazy healthcare system, which if you don't know can be very expensive for you. That's
I
why.
can't tell you how many times I had
Yeah.
my clients just reach out to me like, "Oh, the bill looks so big. What's going on?" So what I actually do, I help all my personal clients just go through it and we'll analyze it together. And very often it could be like a simple billing error that you can fix, which either I can contact the company or they have to contact the company, depends on the insurance carrier. But it is something that I do help my clients with because I understand how frustrating it is, and people don't understand how health insurance works in general. Like, some people think that you just pay for your premiums and everything has to be included, but it's not.
Mhm.
It's just not the reality. Or some people think that if they have a copay and they pay that copay, then they're not going to get a bill after. But then what happens then if the doctor schedules labs, prescribes your medications, you have to pay for all that stuff separately.
Yep.
Yeah, so it's just important to understand and help somebody. If you don't understand, have somebody help you understand how that works.
Yeah, and I actually have an episode that was from the Nurses on Fire podcast. So before I changed the name to this podcast to Financially Intentional, it was Nurses on Fire. And so I'll reference the episode that I have in there in the show notes with Angel Salucci. She's a registered nurse, family nurse practitioner that all she does is look at medical bills and analyzes them for people to help mitigate those errors. So she used to work for insurance companies. She used to do it on the insurance company side and has identified millions of dollars of medical billing errors. And so she has like a keen eye for those kind of things. And so I'll link her episode here if you're interested in like
Nice,
all the
definitely.
ways to mitigate medical billing errors as well, because I think that's super important. And we all have to be financially intentional. And I think this is one of the areas that a lot of people struggle in because they just don't understand. But medical bills, medical charges are all those things are the number one causes of bankruptcy. So we have to be hyper vigilant about these things. Sana, so
Definitely.
do you provide services for people for both private insurance and the marketplace or just private insurance?
Yes, correct. I do help with both.
Okay.
So my process is very simple. It's just based on your situation, based on your family size and the income. We'll take a look at the marketplace. We'll see what you qualify for there. Over there, I will ask you a few questions to determine whether you're healthy enough to get approved on the private plans, as well as I will let you know what they don't cover. And then I just basically evaluate your situation. I'll give you all your options, and then you can make the decision what works best for you. And like I said, sometimes it's just they don't have great options through the marketplace, and it's just it depends. Yes, but I will help definitely to take a look at everything, and then you can make your decision to what works best for you.
I love that because it is and can be very overwhelming. And I love that you even offer the service for your clients to walk them through their medical bills. And I think that's amazing. And that speaks to why you should have someone and work with someone in your corner. Don't go into this just willy nilly and just going in and picking an insurance and not really understanding. It's
I
really
don't
good, yeah, to have an ally in this space to help handhold and walk you through these
Definitely.
processes.
And there's so much also misinformation out there.
Yeah.
Like I want to share like a really like tragic story, but obviously I won't mention any names, but one of my clients mentioned that she had a nurse in her hospital that she lost insurance and she was uninsured. She was just taking assignments and didn't take the agency insurance, and then she discovered she had a lump in her breast, and she was told by someone that she cannot qualify for health insurance now that she has a pre-existing condition. And she tried to get a full-time job with full benefits, and it took about 30 to 60 days to kick in. She ended up passing away simply because she was, and I don't know if this wouldn't have happened if she obtained insurance right on time, but she had a fear of not being able to get insurance because she has a pre-existing condition. That's wrong. And
I don't know
she ended
why
up not
somebody would
getting
say that.
proper,
Like, that is,
yeah,
since Obamacare, that's not even a thing
it's not.
anymore. It's against the law to,
Maybe she
yeah.
thought because she missed the open enrollment, but she didn't know she basically has a 60 days special open enrollment if she loses insurance through her job. And it's just not, it's not that hard if you have the right person helping you to, but it's just so sad to me that people would do that. And I'm not saying it could be somebody did it intentionally, but maybe she didn't qualify for their plans and they said, no, sorry, we can't insure you. And then she just thought that she couldn't get any insurance. But misinformation about health insurance is left and right, and people just don't know. And
So
it's,
I want to pull that out because I really want to highlight this point. You can get health insurance with a pre-existing condition. That used to be something when I was younger. I remember like in my early 20s before Obamacare and before there was major changes to healthcare legislation, that was a thing, but that is no longer a thing. So I just want to pull that out because I'm
yes,
sure a lot of people believe that is a myth.
yes, it is. It is 100% a myth. When Obama did the whole healthcare reform, no more pre-existing conditions, discrimination. They don't ask you any medical questions. Now that's how those plans can be very expensive. Because if you're a healthy 30-year-old that makes, I don't know, $100,000 a year, you're going to pay the same price as a diabetic 30-year-old who makes $100,000. That's when you have private options that come into place. And if you're healthy, you can qualify for them. Hey, they're not going to cover a few things, but maybe you don't need them. So it's good to like research and talk to somebody who knows about all the ins and outs, and just make sure that you speak to somebody who's also not trying to push you just get one plan, one policy, because that just, to me, that's sketchy right away.
Exactly. So you need somebody who doesn't have a vested interest in a particular insurance company. And that's a thing, like you said, like the misinformation. Somebody can click healthcare.com and then be led
Yes.
into these people that are just trying to pirate your information and kind of not working in your best interest. So this is one of those markets where you can easily be paying a lot more because the prices are so different across the board. And for the same coverage, you can be paying super different prices for your insurance, copayments, there's just medical cost in general. But what you need to understand is that you have to get the health care that is right for your existing conditions, for your kids, your family size, for what's going on. So that's why it's super important to have an ally in this space that you know does not have a vested interest in this company, not in these companies, non-biased, that is going to research specifically insurances for you that has years of experience like Oksana. So I think that what you're doing is super important. And a lot of people don't even know that people like you exist. And so that's why I'm glad that you're here talking about it. Let's talk about pricing and like how variable it is.
Yeah, so prices will depend. If you're going through the marketplace, it's always going to be based on your income. Like I said, it's how they determine how much to contribute and help you pay for insurance. Now, there's a few different state programs. There's Medicaid, and then there's healthcare.gov, which is Obamacare. So the one thing to remember, if sometimes you're going through a series of you lost your job, you don't have any income, you can apply for Medicaid. Usually the cutoff is about 13, 14,000 of income that if you make under 13, 14, you qualify for Medicaid yearly. And you can apply for that. And as soon as you get a job, they can potentially kick you off. And once you start making income, just make sure that you adjust that with Medicaid or healthcare.gov whenever you're working with them, just so you don't get billed at the end of the year or get it taken out of your taxes. Like I said, I have a lot of people that are going through that and they didn't know, or they got a wrong advice, or just lower it a little bit. Like I've heard that so many times. Do not do that. I always tell my people to overshoot a little bit, even if you're not going to make that much. But if you do, maybe you pick another assignment or stay longer at another assignment. Basically, if you put a little bit more but you make less, they'll give you some money back. So that's how it works. But if you don't qualify for any financial assistance, like for example, I don't, and I'm 35, I pay $400 for my insurance privately. I pay about 400, and that's the average cost. It would be anywhere between 3 to 400. Now, what I like to add all kinds of like supplements on my policy, just because I know I see those bills all the time and I don't want to get hospitalized. I do have a deductible. I do have a max out of pocket, but I personally purchase a lot of supplements just to help me with accident protection, supplements that help me pay for my deductibles if I ever get a surgery or hospitalization. So I have all that stuff on myself. But yes, usually pricing depends on the family size and your income. If you go through the marketplace, it's literally just there's no one price or per state. The state charges this, state charges that. It's not one size fits all. It's all very personal. On a private insurance market, you usually looking at 3 to 400 if you're in your 30s, and if you're in your 40s, 4 to 500, and so on.
So a lot of my listeners are going to fall either like in one of three categories. So they're going to be, if they're not tradition, if they're not employed through it, they don't have insurance through their employer. Either they're going to be somebody who's in early retirement, who is not traditionally employed, but maybe living off of like investment income, which is can easily fall in that Medicare range, or someone who is 1099 employee. I have a lot of people who just do contracts and all that stuff. And then I have people who are getting close to retirement age but won't have coverage from their employers. So these are people that you can typically help. So I just
Yes.
want to walk through an example of somebody who's like me in their early 40s, and I want to take a gap year off where I don't want to be employed. I won't be really drawing any income. I could live off of some of my investment accounts and I fall in that Medicare range. What would that look like for me in that little early mini retirement or gap year?
If you qualify, Medicaid is free. And I know you said Medicare is
Sorry.
for 65 and up.
Yeah,
No, it's okay.
I always do that.
I used to do the same thing, but Medicaid, think about it like it's a financial aid. When Medicare, it's like care for elderly. So,
Yes.
so if you qualify for Medicaid, Medicaid is free. So you'll get free insurance through state, all your preventative. If you're Once you get kicked off of the Medicaid, if you start bringing in a little bit of income, you automatically go to onto the
Yep.
marketplace. And that will start most likely also from zero. It could be $20 for your plan. I know that you have children, so you have dependents. That plays a huge role. If you have dependents, if you're a single mother with multiple dependents, they'll help you a lot more versus you having an actual spouse who also contributes. So it just depends. It really depends. But as long as your taxable income is, and if you're not an individual, if you're a family, it goes up. So if an individual, you have to make under 15,000. For a family, it has to be a little bit more, like 20, 25. So you'll be fine as long as it's not like a taxable income that you're getting. And sometimes I know people like sell houses and they don't count that into the income. All that stuff that is taxable
That's interesting.
counts.
Oh,
Yes.
okay. So the people
All
don't count that into it, but
people,
the government is going to count
the
that.
government
Okay.
does.
Yes.
Yes,
Okay.
yes.
That's what
Yeah,
I
yeah,
did.
yeah,
Thank you for
yeah,
clarifying
yeah.
that. Because, yeah,
No,
the
yeah,
government is
yeah.
definitely going to count
Government's
that.
gonna definitely
Yes.
count, yes.
Yeah. If you're a real estate agent, don't say you didn't make any money this year, but you sold a
Yeah.
couple of houses. That's all income. Okay. Yes. I got it.
If you sell your own house, does it count as an income?
Yes, it does.
There you go.
Hey,
That's
that
what kind of
oh, okay, that's
that
what you mean,
yeah.
okay.
So if you're selling something, yeah, and
Yes,
it's going to be registered, counts as an income too, because you cannot be maybe not working, but you decided to sell your multi-million dollar house, and then that counts as income.
and if you're drawing off of your retirement accounts or you're drawing off of, like, savings accounts, does that counts as your income for that year too, right?
Correct. So
Yes.
you have to be careful.
Just to be explicit about it. So there's no question. So there's no question. Yeah, so there's a lot of people that fall within that category of this self-employment with kids, without kids, that just need to know their options. And I think it like even in this conversation, you'll see that there's so many things that you just don't know. Like I said, this is something I have a master's degree in, but I'm not particularly in health insurance, and it still can be very confusing.
Of
Walk us
course.
through how people can work with you, get in contact with you.
It's pretty easy. You just can just go to my website. It's simplehealthquotes.com. It'll give you a simple form to fill out with just a couple questions, and then I will reach out to you, or one of my team members reach out to you, and we'll schedule a consultation where we can actually walk you through everything and show you all the available options. Now, it will depend on the state. Again, some of the states I personally don't have a license in, because it's pretty impossible to get licensed in all states for health insurance agents. But if I don't have a license there, I will definitely either recommend you to one of my colleagues who does, or I'll definitely point you in the right direction with at least a website where to go to.
Nice, nice. And what states do you primarily focus on?
So I cover over 30 states,
Okay.
so I'm not going to mention
You
all
do
of
not
them.
have to
Let
list
me
them
just,
out. Yes.
yeah, let me just mention the ones that have their own systems. So states like California, New York, New Jersey, there's a few others, Idaho, they have their own marketplace, and they don't allow, like a lot of agents, you have to be a resident to be able to offer insurance there, or they just don't allow enough private options for agents to even be interested in getting a license there, because to be honest with you, like the marketplace doesn't pay very much to the insurance agents. But states like New York, California, New Jersey, what are some of the big ones too? Everything like around California, pretty much like all that, like Oregon, Washington, DC. You just have to go through healthcare.gov for some states like that.
Okay, okay. But if somebody from California reached out to you, you wouldn't be able to help them or you
I have,
yes.
oh no,
Okay,
I would. I
okay,
have an agent that I network with
okay.
in California. So he helps me with all my California inquiries. Same thing with New York and New Jersey. And you have to also keep in mind some states, I don't know if you remember, there used to be a penalty for not having
Mhm.
insurance through the marketplace or employer. So Trump actually removed it in 2019, I believe. But there are some states that still have that. I believe New Jersey is one of them. There's like maybe three or four states, so you have to be careful too.
So not only was there a federal penalty for not having insurance, you would get a state penalty for that as well?
Now it's only a few states, yes, that
Wow,
have that.
see? The more I didn't
Yeah.
know that at all.
But yeah, you don't. I don't think it applies in California. You're fine, but in, yeah, definitely like New Jersey. I don't know New York if they do or not, but it's listed. It's all on healthcare.gov. They'll
Okay. And
tell
what
you.
if people are employed but are like exploring options like early retirement, gap years, self-employment, like a nurse that wants to go from being a staff nurse to being a travel nurse? Can they reach out to you and get help and just thinking through that process and what it would look like?
Of course, a lot of my clients, they reach out to me for that exact same reason. They need to be more educated on health insurance before they make that decision to move forward with their plans. And yeah, for the most part, I can help everybody, just to give them peace of mind, knowing that they can pursue their dreams and not having to depend on employer insurance. Yes,
And
they
another
can
thing
definitely reach
that
out.
offers peace of mind is that your consultations are free, correct?
Yes,
Yes.
correct.
Yes.
Consultations are free and no charge, no obligation. Yeah, the majority of my clients I get is just by word of mouth. People recommend me, refer me. Yeah, I'm happy to help as many people as I possibly can.
Cool. And the thing is that sometimes a lot of people feel overwhelmed by the process, and there can be a lot of scammy people out there. So just to know that there's somebody, a face that you can actually trust, is a lot of reassurance. So again, Oksana, I really appreciate what you're doing. Thank you for always dropping gems. You always teach
Thank
me
you.
something every time I have a conversation with you. So
So do you. I always learn so much from you.
if you don't have friends that you can learn from.
Yay! Exactly.
But anyway, all your resources will be in the show notes. Make sure you guys, even if you're not in a situation that you might need Oksana, make sure you keep her information in your back pocket because things do change. And there may be a time where you need to step out of being under employment insurance for whatever reason. So make sure you know what your options are and know that you have an ally that's going to look out for your best interest. So thank you again, Oksana.
Thank you so much, Nazima. Thank you.